October is Breast Cancer Awareness Month, and some local doctors are using a new AI tool to help detect breast cancer earlier and with more accuracy. Chief Medical Officer with Axia Women's Health, Dr. Richard Gates, is here with us this morning to talk about it. So this is called a MammoScreen. What is it exactly?
Yeah, MammoScreen is actually an AI, artificial intelligence assisted, computer-assisted detection technology, which helps the radiologist in terms of their readings. It works alongside the radiologist as they're analyzing a mammogram, and essentially provides a second set of eyes to assessing that imaging.
So you just started using this tool in August. How is it a second set of eyes? How does it work?
Yeah, we've been looking at it, and we made that decision. You know, it's the best product out there, and it's definitely higher quality, so we need to dive into that. And we just started that in August. What happens is it's no different for the patient. They come in, they have the mammogram, they notice nothing different. On the other side, or behind the scenes, that technology then takes a look at that image and analyzes it along with the radiologist, and again, as a second set of eyes. It's FDA approved, or FDA cleared, and the AI system's been trained on millions and millions of mammograms, both two-dimensional and three-dimensional, to really identify at a very discrete level more subtle abnormalities on the mammogram. It then takes those images and it assigns a score anywhere from 1 to 10, which is an index on their level of suspicion. So the lower numbers being a lower level of suspicion, and the higher numbers being a higher level of suspicion for any detectable findings on that imaging.
Okay, so it can look at what we're seeing here on this video and have a better eye, I guess, than even maybe a doctor might have. What have the results been so far?
So far, it's been interesting. It's early in the game for us, and so as far as practically within our offices, it maybe is a little too soon to tell. I mean, I personally have had a patient. I wonder if it was that was diagnosed soon thereafter. So I was wondering if that could very well be responsible for that earlier detection. But the results, in terms of the studies and the results ongoing, have been incredibly encouraging. The advantages to doing it, not only is it a big satisfier for the radiologist, there's a correlation of using AI and the radiologist, from radiologist to radiologist agreeing on that assessment, potentially lowering the incidence of what we call false positives, which are exams that are done that may reveal an abnormality, but after additional testing, there is no abnormal finding. But more importantly, a lot of the studies show that up to 40% of screening detectable cancers may be seen even 2 years earlier.
Wow.
So the premise of the importance of that, if you will, is that if we're able to see things earlier, we're able to start treatment earlier, and we end up with better outcomes, better quality.
And this, patients don't notice a difference, also no different cost for them if they're going to get a mammogram anyways. So
mammograms are generally covered by insurance as is. This is an add-on, if you will, that we are now providing at no additional cost to the patient.
Quickly, before we go, remind us, what are the guidelines for getting a mammogram? When should you be getting screened?
Routinely, normal risk patients, we always recommend starting, women do annual mammography starting at 40. That's supported by the American College of OBGYNs. There are certainly some situations in some women that may be high risk, that may warrant earlier screening, and so they may end up going mammography sooner than that, based on their risk assessment.
Hey, great information this morning, Dr. Gates. Thank you so much. We appreciate it.
Thanks for having me.
It is